Hi, this is Jack again. This is part 2 of our congenital cardiac lesions talk, looking at right to left shunts. So hopefully you've seen part 1, which is all about left to right shunts. At the end of part 3, there will be an SBA and a quick summary slide on all the different types of heart lesions that we've talked about as well. Here's the anatomy of the normal heart again. So the thing about the right to left shunts is, for whatever reason, you have a reversal of the direction of flow compared to normal. So there are two major types of right to left shunt that we'll talk about in a moment, although others do exist. We mentioned Eisenmenger last time, and that is a right to left shunt, although you're very unlikely to need to come across it. But just remember, that's where you have a VSD and a left to right shunt, and then it reverses because you suddenly have got an increase in pressure on the right side compared to the left due to a long period of time of increased flow, which slowly changes your vasculature so that then your resistance increases in your pulmonary vasculature. And then eventually that will get past the point where it's systemic, or at least systemic part of the time, and then you'll get a reversal of flow, and then that is can be catastrophically bad. Children with Eisenmenger syndrome will present with heart failure that can be both right and left sided in terms of its symptoms, and the only real way of treating that is with heart transplant, although you can manage it temporarily with medicines that reduce their pulmonary pressure, so things like prostaglandins. That's something to look up extra to this, to be honest. So right to left shunts. So essentially the key to remember is that you've got cyanosis and it's not oxygen responsive. So it might go up a little bit with oxygen, but you can test this with the oxygenation test. So you think someone is a baby and they're blue and their SATs are low, and you're not sure whether they've got a cardiac lesion or not. And really, we don't do this anymore because we have echocardiography, which will give us the answer. But if you put them in an oxygen box and you put them in 100% oxygen and you take arterial blood gases, you will see that their oxygen level in their arteries does not go up as you increase their FiO2. You can't fix it by just throwing oxygen at the problem. So there's two main types. We've got a tetralogy of Fallot, which is by far the most common, and you've got transposition of great arteries, which is kind of a quasi right to left shunt, but it is cyanotic heart disease.